survived 2 cancers. The first one was a cervical cancer in 1990, and the second was a colon in 2011.
Welcome to Dependency TV.
Reality TV at its best.
Where every life is a biography.
I'm Gav Sinclair.
And I'm Natasha Nunez. Today on Iron Dependency, we explore the topic of cancer, specifically those that affect women. We speak with a woman who survived not 1, but 2 types of cancer in her lifetime. How much of a toll did it take on her body and mind? And what advice does she have for others?
We will also speak with an expert from the Ministry of Health about the pervasiveness of female cancers of cervix and breast, as well as the chances of survival in the latter stages of the disease.
Well, it was clear I had not done my pap smear. And the irony of that is when you came into my office, immediately behind me on my desk was a huge poster which said you should go and do your pap smear. So that information was for everybody else but me, because I didn't go. And in fact, in February of 1990, I started bleeding profusely, and I still didn't do anything about it. It was not until June. I'm sitting in a meeting in the PAHO office next to Veronica Roach, who was then working at the Cancer Society. And I said, you know, Veronica, I have to come to see you for the longest while about this bleeding. And then I told her what had been happening since February. And she put me in her car right away and took me to Dr. Narayan Singh's office. And I think I have to always say he saved my life. Because if I hadn't gone then, I would not be sitting here today. So we do the test, take the sample with the old machine, and now we go through another process of the diagnosis, which has to be done. They told me come back in 7 days. I go back in 7 days for the results. I got it, and took it back to Dr. Ryan, saying this thing says that we are in stage 3. So therefore you have to go and do the surgery right away. And that's another story. The process of getting to the surgery is one that kills people as well. People are not dying from cancer, you know. Many of them are dying from the system and the process. Sent to San Fernando General Hospital because that was the place where I was likely to get it as the soonest. Actually, it was the day that in 1990 when the state of emergency was declared. I am lying in the San Fernando General Hospital after a surgery, which was quite dramatic. In fact, Dr. Ryan Singh said it took 3 hours, and the reason I survived because I presented him with a healthy body. And that is the other thing that I need to get over to people. The reason why you have to have a healthy body is because when you find yourself confronted with this, then your body is able to survive. If I had not presented him with a healthy body in 1990, I would not be sitting here.
Funds have been raised by countries, especially in Europe, to pre-finance the development of the vaccines, because it is a pandemic. It's not just an epidemic, or it's not just in a few countries, it's a pandemic. So there's been an unprecedented drive, never before done, never, of the vaccine manufacturers working with WHO, working with the Gavi Alliance, which gives vaccines at no cost to many low-income countries. There are 3 arms to this whole program, but the COVAX is the vaccine arm, and the funding has come, as I said, from several countries, especially in Europe, that have pre-financed the development of the vaccines in several countries to several manufacturers at the same time. And they said, okay, we're going to give you the money, ready, set, go, start working on the vaccine.
think I need to start off by saying the service that is offered in St. James Radiotherapy is excellent. The doctors there are world class, as are the nurses. When you go there, you get a level of customer and personal service that you don't get in many other government institutions. So I went there to do the radiation therapy and all of the regular blood work that was required in order to monitor what was happening with my cancer. And like I said, the service at St. James has always been excellent. So I came out of there with some very interesting relationships with the people who worked in that center, which was able to help me to do some other work that I did in Guyana in respect of treatment for cancer patients. Well, actually, it's a lack of knowledge. And in my case, it wasn't a lack of knowledge, but I think for most people it is they don't know what this thing is. And because most of what they hear is that people die, it's important that the information about diagnosis and screening be conveyed in a way that doesn't connote death. Because I say to people, cancer doesn't kill you. It's all in your head. It depends on what kind of body you present and how you think about the process. And also in respect of how people approach their treatment, I always say, it's your body. You have to maintain some autonomy over it and the decisions that are taken about what they do or what you don't do. As much as the doctors are expert, you and your body know more about you and your body than the doctor will ever know. So you need to be able to encourage people, whatever happens, you are still in charge of what happens to you. There are some networks of women that are around who are of taking responsibility, especially those like in the family planning and other women's health organizations. So even the ones who are dealing with breastfeeding or Mama Tutu, all of those other people are good sources of getting information about how you take care of, especially how do you recognize the symptoms. And of course for cervical cancer, the symptoms, while sometimes could be extreme, is not much different from a heavy period. You talk about how you get the message across. I think we underestimate the influence of friends and family in this whole process that you go through, because for me, it was mostly the people who I consider to be my friends, who were the ones who were the most supportive in taking you through the process. And in final analysis, people like Veronica Roach, who I always talk about, who have been in the forefront of the advocacy for helping people to understand what this whole cancer story is about and what their responsibility is. Because again, it comes back to what is your responsibility for your own health. The doctor will help you, they are experts, they know what they're doing. But you yourself have to be involved in a way that ensures that you survive. And it brings you back to the role that people in your family play in this business. Because for me, the most traumatic part of the exercise was not the diagnosis that I had it, but how do I tell my mother and my children that this is what we are all going to go through, because the process was not for me alone. I didn't go through it alone, but we're coming from different spaces and different levels and kinds of relationship in dealing with it. And that is very important in my view. Many times depends on whether you live or survive. Well, I think there has been some improvement in the service. So for example, but it comes and goes, depends on who's in charge. So for example, the whole business, I think, of the cancer registry, which is, I think is now being revived, but which was a very important source of information. Because if you want to do advocacy around cervical cancer, you need to know something about who are the people who are most at risk. Where are they? How you find them? How do you communicate with that particular group of people? Are certain ethnic groups or ages more vulnerable, so that you can target your message? You don't try to cover everybody in the world. There are certain groups that are more vulnerable and need more information and attention than others, and you are able, and that's one of the things that the registry was designed to do, so that the message could be better targeted for the people who are at risk. Very much so, because it is done at the most critical stage. That is one of the things that has already been identified, that if you reach girls at that age, you're more likely to have less incidence of cancer of all kinds, but certainly of the cervical one. And and people must know that the vaccinations are safe for girls at that age, and build the confidence. Of course, the confidence depends on the source of the information. There are some sources of information which are not trusted, and therefore you have to know what source of information do you use to reach girls and their parents or their guardians, so that the message gets through to who it has to reach.
There are certain truths in life, that nothing lasts forever, and no matter how challenging things seem now, it will all pass. That the world is full of endless possibilities, and all of life is precious. But we are all connected on this beautiful earth we share together, and everyone needs someone to be there for us when it matters most. No matter who we are or where we're from, one way, one world. Live easy with Guardian Group.
At the Ministry of Health, we have a department that collects national data on all cancers called the National Registry of Trinidad and Tobago. So they are authorized to collect this data and provide this to us at the Ministry to help us in terms of planning and programs. Sometimes, of course, this data takes a while to be collated, so they work in 5-year periods. So the last reporting period has just ended. It's going to be December 2018, but those statistics are not available. So we have for a 5-year period for 2009 to 2013. So for that 5-year period, these are patients who have reported in their registry. They had 5,000 cases of all cancers in females. And those cancers range from the commonest cancer, which is breast cancer, all the way down to other rare cancers. In terms of breast cancer, there was 1,608 recorded cases in that 5-year period. So, in terms of the overall cancers, we're looking at about 1,000 women who are diagnosed with some type of cancer in any given year, which almost works out to every day 3 women are diagnosed with some form of cancer in Trinidad and Tobago for that reporting period. When we get the new statistics, the information will change. The commonest cancer of the women's cancer make up about 1/3 of the cancers in women in Trinidad and Tobago. That's breast cancer. That's followed by cancer of the bowel, colon and rectum, which makes up about 10% of the cancers, followed by cervix cancer, which is very popular, and in terms of campaigns, you always hear about cervical cancer. To women's health, in particular, I look after women in labor and for the pregnancy, as well as the newborn infant. That's what we specialize in my unit at the Ministry of Health. But we also cover women through all aspects of the life course, cancer being one of them. So we have started to take an approach from the Ministry of Health to coordinate what we do for the entire population. Previously, it was probably not well coordinated, so we put women in the focus. We have a saying that you need to be responsible for your own health. It's not somebody else's fault. Sometimes it's your life's choices, and these are messages we are talking to adults most time. You should be aware of looking after your personal health. Prevention is key. Prevention includes living a healthy lifestyle, making the right choices when you eat, finding time to exercise. That's first and foremost the key parts. Some people, we are still smoking cigarettes. We are still consuming too much alcohol. Sometimes there are society reasons for all of these, but they all contribute to overall getting cancer. It's not as simple as that, however. Those are lifestyle interventions in terms of helping to reduce the chance of getting cancer, but there are some genetic reasons why some people may get cancer, and especially so for cervical cancer, we have actually identified the actual cause of cervical cancer for most persons. In over 90% of cases, it's due to a type of virus called the HPV virus. So we have now targeted an intervention, which is the HPV vaccine. We have now years of research and years of data which show that that vaccine is proven effective in reducing the chance of getting what's called pre-cancer before it changes to cancer, as well as getting cancer. Of course, genetic research is evolving, and the more we get scientific information, we are starting to identify certain genetic traits which predispose you to getting cancer. So we have recognized, for example, breast cancer and ovarian cancer, very specific genes which increase your risk sometimes as high as 50% of getting those cancers, breast cancer, ovarian cancer, in your lifetime. So you may come from a family, and that's why we ask those questions. When we ask about your whole history, we ask, do you have any first-degree relatives who have had a cancer? And we are able to now map whether you have that risk. And some of those tests are available in genetic labs in Trinidad and Tobago, and we can actually give you that advice whether you need to take certain actions. It's like every medical condition. We lump cancer and we say cancer. But there are all sorts of possibilities when it comes to cancer. It depends on, of course, the type of cancer. The stage of cancer where it's diagnosed is very important. And then, of course, whether there are patient factors. If you are ill to start with, if you have other health conditions, you're diabetic, hypertensive, heart disease, you're older, then your prognosis may not be as well as for the younger patient who is diagnosed with cancer in the early stages.
Right.
When it also comes to cancer, some cancers have different types and subtypes. So you may say cervical cancer, but there are different subtypes of cervical cancer. So it's hard to generalize sometimes. There are some aggressive types of each cancer. So when you see your clinician, they will individualize. They'll say, okay, we have this cancer. It may be at this stage. It may be at this grade. And they will have worked out roughly the prognosis. Early stage disease generally equals to very good prognosis. In terms of 5-year survival rates, they're very good if you're diagnosed early enough for all types of cancers. Generally, looking after your general health is very important. Treating the body, the mind. It's not just about the surgery, radiation, chemotherapy, and preparing sometimes. Sometimes it may be in improving the whole aura about the person is also important. We realize that as physicians, sometimes we focus on just purely the medical and the condition and not the person, or even the family support and unit around them. That's very important when it comes to any health condition, not just cancer. We must be aware that the HPV virus actually exists in all of us. There are so many different subtypes, but there are very specific subtypes which cause the cancer, which are what the vaccine program is all about. So we have launched a campaign at the Ministry of Health in association with partners from MD Anderson, USA, which is one of the best cancer centers in the world, through another organization called PSI Caribbean. And this year we are actually relaunching the promotion of the vaccine. We actually have good news with respect to that HPV vaccine. If you had to purchase this vaccine, it would be quite costly. But several years ago, the government decided to add the HPV vaccine to our expanded program of immunization schedule. So it's available free to us as end users. Primarily, we are targeting younger persons, really it's the pre-adolescent persons, males and females. It's not just about women. because the sexually transmitted part of it, it can actually pass from male to female and vice versa. So we're targeting males and females because the vaccines also, not just with respect to cervical cancer, they can stop you developing warts in that area as well as some other cancers. They actually can, the same virus is associated with cancer in the upper airways, the mouth, the throat. It's also associated with penile cancer, vulval cancer, that's in that area, and vaginal cancer, and anal cancer. So there's other benefits to taking the vaccine, not just cervical cancer. We have actually one of the best healthcare systems if you really look deep into the system. I mean, we always have the negative comments and so, but we have a very robust healthcare system in Trinidad and Tobago, which is well funded. So our basket of services that are offered at any health center, there are over 105 health centers and public hospitals as well, where so much is offered to you, including the vaccine, and you're not out of pocket at that time. We're funded through taxpayers and government projects and so on, but it's available to you. If you were in the United States, for example, and you didn't have health care, those persons are out of pocket and now have to pay for these additional vaccines. We have a system where you have that vaccine available, and we are seeing improved rates actually. I actually spoke with the person in charge of Ms. Grace Sukchan, who is in charge of the EPI program, and she's saying that she's seen an upsurge in the HPV vaccine rates. We now have a program where at the school level, we need to target those persons because you can get away with just having 2 vaccines if you're below the age of 15, but you need 3 if you're above 15. So we can save on costs, and it has been shown long-term protection when that person eventually may become sexually active and so on. So you start the protection way before they had a chance to be exposed to the HPV virus.
Agricola Credit Union Cooperative Society Limited introduces its new and improved mortgage loan package from as low as 5% per annum. Home renovation, purchasing a home, constructing a home. Come to your credit union today. Speak to our friendly and courteous staff. See your dreams come true. All lending criteria apply. Check us at our head office, 20 Phillip Street, Port of Spain. Arima branch office, Pro Queen Street, Arima. Tobago office, Plymouth Road, Scarborough, Tobago. And our Marabella office, Pamela's Mall, Marabella. Agricola Credit Union, your very own, working for you. Some of us like to play games of chance, but remember, gaming should be fun, so don't get carried away. Play for a prize, but don't pay the price. Play for fun, but never for keeps. Play smart, but never play all. Winning isn't everything. If you or someone you know needs help, call our gambling addiction hotlines. Rebirth House 24-hour hotline 466-3146 or Serenity Place Empowerment Center for Women 648-5401. An initiative of NLCB and Eye on Dependency.
Right. So, well, of course, there are public education campaigns. So we have information, first and foremost, on social media. We have website information. Persons may want to access that sort of information in the privacy of their homes. There are contact numbers listed as well on the Ministry of Health's website. You can phone in to call-in numbers at all of the regional health authorities. All of the health centers are actually listed there as well. You can make an appointment to see someone. You can find out what day they do offer those services. But it's widely available throughout Trinidad and Tobago. Relatively, it's, everyone lives in close vicinity of a healthcare center. There are also printed material in terms of preventative medical checkups that we offer as well. For example, in cervical cancer, and that's something we need to highlight. Once you're over the age of 20 years of age, and you're between the ages of 20 and 65, we have a program. Once you're sexually active, we recommend a minimum of 1 pap smear every 3 years. If you get that is highly likely to prevent you from getting cervical cancer. With just 1 normal pap smear, protects you for years in the future. One advantage of cervical cancer, it takes years to develop cervical cancer when it goes through its different stages. From pre-cancer to cancer takes some time. So we actually gain some time. And if that pre-cancer is detected, we can remove it without having to remove the organ itself. So you're well, you just have to have follow-ups, and it's curable. So that's a big advantage of having a pap smear as a screening tool. It's one of the best tools we have available. And then coming in the next year or so, we'll formalize what's called HPV testing of the pap smear. So we'll actually test to see if you have that virus that can cause cancer. So you will be on higher surveillance. Plus, if it's negative, you don't need as much pap smears as well. So it will reduce the number of smears you have. So there are some benefits to introducing that technology in Trinidad and Tobago. So we're doing a pilot project this year with the Northwest Regional Health Authority with that HPV testing in the public system. So part of the innovation that is coming out of the Directorate of Women's Health. My name is Dr. Adesh Sirjusingh. I'm the Director of Women's Health. We are at the unit of the Directorate of Women's Health in the Ministry of Health. My closing advice is that women need to be responsible for their health. The women are at the center of the family unit. Without a healthy woman, the entire family may fall apart. And I'm encouraging women as well as their relatives and their partners to encourage the woman to take care of their health. There's so many things they can do, including education, self-checks, breast checks, mammograms as well. We didn't speak much on mammograms. Mammograms are advocated in Trinidad and Tobago for women over the age of 50. We're now starting a formalized program, and that's every 3 years at a minimum up to the age of 70. So that's another way of screening for breast cancer outside of your self-checks. So that's another, in terms of we talked about bowel cancer being an issue as well for women as well as men. So that's where colonoscopy is coming and preventative checks.
A cancer diagnosis is not a death sentence. Prevention is important and early detection is helpful. Treatment with support from friends and family is essential for recovery.
So join us again for another informative edition of Dependency TV, where we continue the discussion about cancers that affect men. See you then.
Eye on Dependency. Reality radio at its best every Sunday from 6:15 to 8 p.m. on I 95.5 FM. Don't miss it.